Cold remedies are as common as a common cold, but I talked to a pharmacist who told me which over-the-counter medicines will get you back on your feet the quickest. Well, 'tis the season, cold and flu season, and if you don't have it, I'm sure you know somebody who does, or maybe your kid's suffering from the cold or flu. And so I decided to come to Walgreens today and talk to one of the pharmacists. I have Roseanne with me, Roseanne McNeely. She's a registered pharmacist here, and she's going to talk to us a bit about some of the symptoms for colds and what you can do to kind of relieve some of those symptoms. Can you first talk about some of the symptoms of cold, flu, that type of thing, the difference?
Normally, an adult appearing with a cold can have congestion, sinus congestion. Then ultimately it will lead to cough sometimes. So we'll start with congestion, and we normally treat that with a sinus congestant, although it would depend on health conditions as far as what we recommend. But normally Sudafed is what we recommend for sinus congestion.
Okay.
And Sudafed is available over the counter, but it also is available behind the counter with the identification. So we normally sell that for sinus congestion.
So that's just one of the things, congestion.
Right.
And then I know sometimes you get, what, cough, sore throat, all
Cough,
that good
sore
stuff.
throat. Cough we normally recommend depending on whether it's productive or not. If it's productive, we normally try to let that cough and that phlegm come up. Otherwise, we use something like Delsum or Robitussin DM to stop a dry hacking cough. And always with cough and cold, flu, if there's fever, we normally recommend either acetaminophen, which is active ingredient in Tylenol, or ibuprofen, which is Advil, that kind of thing.
Okay, and then what about if you have like aches and pains and all that stuff?
Same kind of thing. Advil, Tylenol, those all work for aches and pains.
Okay.
So they're kind of a dual drug.
All right, and one more question. When do you need to go to the doctor? A lot of times you get the symptoms and you go get to the over-counter stuff, but is there a point where you need to go to the doctor?
Absolutely. If there's fever, you probably, lasting 2 or 3 days, you definitely would want to go to the doctor at any point with fever. However, if it's a cold is viral, so a lot of times there isn't much that a doctor can do for you for a virus other than suggest symptomatic relief, so with over-the-counter products. So, but after 7 days, I would say definitely a doctor.
Okay, great.
Absolutely.
Well, I was talking to Roseanne earlier, and she was telling us that some of these remedies not okay for kids. So coming up in the next half hour, we're going to talk about some things you can do for your kids if they're suffering from the cold or flu this season.